Therapeutic fasting: benefits, protocol, duration, dangers. Therapeutic fasting would promote the regeneration of the immune system and the resting of the digestive system. Yet its positive effects have never been scientifically validated, and it remains controversial in the medical community. What are its benefits? How to do? Protocol and dangers with Karine de la Rouère, dietitian nutritionist. Definition. What is therapeutic fasting? Therapeutic fasting consists of voluntarily depriving oneself of all solid or liquid food for a given period. Only water is allowed. It is called therapeutic because it would have preventive and curative virtues on many diseases. Therapeutic fasting is generally partial, intermittent fasting or fasting, which means that there is an alternation between fasting periods and food intake. However, to date, therapeutic fasting is not offered in a medical setting in France. It is, however, in other European countries and internationally. The scientific data on the subject being insufficient, the effectiveness of therapeutic fasting is not proven. What are the benefits of therapeutic fasting? Therapeutic fasting would prevent a number of pathologies, including certain cardiovascular diseases, certain digestive pathologies and other chronic diseases, and would reduce the frequency and intensity of joint pain. However, this has never been scientifically proven. What we know is that therapeutic fasting is above all a means of detoxifying your body, since it accelerates the cleaning of cells and tissues, thus promoting their rejuvenation. It also allows the improvement of digestion and assimilation processes. Between 12 and 16 hours of fasting, the liver and the muscles have no more sugar reserves, glycogen, in ketosis. The body then draws on its fat reserves, which it uses as fuel. This phenomenon leads to a decrease in insulin production, fat and sugar storage in the body, which activates nerve cells and strengthens intellectual and physical abilities. Fasting also helps manage hunger, ghrelin, and satiety, leptin, hormones, which can help control eating. From 2 p.m. of fasting, the process of cellular autophagy, that is to say cell renewal, takes place, explains Karine de la Rouère. Protocol. How to do a therapeutic fast. Fasting should not be done overnight. It is essential to prepare the body gradually. We start by reducing our consumption of stimulants, tea, coffee, chocolate. Then we put aside animal proteins, cereal products, and on D3, we stop the consumption of dairy products, eggs and proteins. 2 days before fasting, we eat only fruits and vegetables. Then, it is recommended to drink at least 3 liters of water, indicates the dietitian nutritionist. How long for a therapeutic fast? According to the Ministry of Health and Solidarity, the duration of the therapeutic fast should not exceed a few days, a week maximum. Does therapeutic fasting have a benefit on cancer? Studies on the value of therapeutic fasting in subjects with cancer are controversial. In its pamphlet for the general public and patients, Fasting and Cancer, published in 2018, the Naker Network explains that fasting is not a medicine of the future for fighting cancer. Currently, there is no scientific evidence confirming this idea. Although fasting for therapeutic purposes is in fashion, it is a practice whose benefits are not scientifically proven, and which involves risks. In other words, no one is able to affirm the protective effect of fasting on the occurrence of cancers. Certainly, cancer cells feed on sugar, so we can legitimately think that fasting will weaken them. But at the same time, we take the risk of weakening the body, which will then respond less well to the treatment, comments our interlocutor. Therapeutic fasting presents a number of risks and should never be performed without medical advice. What are the dangers of therapeutic fasting? Therapeutic fasting presents a certain number of risks and should never be carried out without medical advice, warns Karine de la Rouère. This practice is formally not recommended for subjects with kidney or liver disease, pregnant and breastfeeding women, as well as people suffering from eating disorders. Advice is also required for children, adolescents, athletes and the elderly who have specific nutritional needs. Fasting may increase the effects of certain drugs. It is therefore always necessary to seek the advice of a doctor in the event of drug treatment. Additionally, fasting can cause a number of side effects such as headaches, dizziness and malaise. It also leads to deficiencies, especially iron, which can induce anemia.